Hello, I'm Shetty. I'm a researcher at the National Prion Disease and Pathology Surveillance Center at Case Western Reserve University, and I'm also affiliated with the University Hospitals Cleveland Medical Center in Cleveland, Ohio. My research title is Examining Copy Number Variants as a Possible Phenotype Modifier in Prion Disease. I'd like to state the three goals that I'm focusing on for this research. One is to examine the role of copy number variants in young age at onset, sporadic prion disease, such as sporadic CJD, the VV1 subtype, and sporadic fatal insomnia. My second goal is to identify any novel CNVs in genetic prion disease so that which can result in discovering new genetic risk factors. I'll get into a little bit of the details. And then presence of CNVs in the brain. So when you find these CNVs, does this really affect the function, or does it cause the disease, or does it increase susceptibility? We will be doing some functional studies. My group, that is Dr. Appleby, Dr. Calley, and myself, the three of us are going to focus on looking into the comprehensive nature of CNV, not just finding it, but also what does it do functionally. So that is the goal of our research. So to give you a little bit of background, copy number variants, these are small stretches of DNA in our genome that can be deleted, duplicated, or rearranged in the genome. And this is important. It happens in normal population. Like if we tested ourselves, we will find those variations in our genome. It is important for human evolution, and it happens in other species as well. So it is important. The copy number variation is very important for our evolution. However, if this copy number variation happens uh, rarely in a region that contains genes that could impact health or disease, that's the one we are trying to target. We are trying to see if there are rare variants or rare copy number variants that could be predisposing either to prion disease or modifying susceptibility or age of onset. So keeping that in mind, one of the things we want to target is this sporadic prion disease. By sporadic, I mean we don't know why prion disease happens. We know that it is because of the prion protein, misfolding of the protein, but what is that is predisposing a person? Because this is such a rare disease, 1 in a million. So why does it happen in one person, not the rest of the population? So we are trying to understand what is going on in the genome. Could these copy number variants be predisposing to the disease, either early age of onset, or it could be making the phenotype more severe or mild? We'll start with sporadic prion disease, especially the VV1 subtype and of sporadic fatal insomnia, and look for in these young patients. Typically, prion disease happens in older individuals, like in their 60s, but in the VV1 subtype and SFI, it is seen in very young people, young individuals, like in their 20s, which doesn't make sense. Why is it happening in these young people? Like, when it is supposed to be happening, it's so rare, happening in 1 in a million, and in people who are older than 60. And here it's happening in somebody who's 18 or 20. What is predisposing? What is the factor, predisposing factor? And then the second type is the genetic type, where we know that the PRNP gene is a causative gene. So any mutation or defect in that gene is causing genetic prion disease. And these are typically inherited from a carrier parent. So somebody who's carrying the mutation, who at some point may develop the disease. So again, with the same mutation within family, say there are 4 people who have this mutation in the family, but you'll see that someone may never develop the disease. Another family member might develop it at a young age, or someone else may develop it later on. So there is variability, like intra-family variability. Within the family, we see the same gene, same mutation, but the effect is different. Either they never develop the disease, or if they develop it, it's very young, at a very young age, or they might develop it at a later age. And the phenotype, like the expression, the cognitive decline, it might be slow, could be fast. So there are variability, and it doesn't make sense that this prion gene is behaving differently, the same mutation is behaving differently. So we are trying to figure out if these CNVs, the rare novel CNVs, could they be the risk factors? Either they are being protective, just presence of these stretches of DNA that are variable. Could that be protecting a patient or an individual versus not protecting or making the other person more susceptible? So once we identify these CNVs, we want to know, are these CNVs just, did we just happen to see it in the brain? Is it truly causing the disease, or is it making the person susceptible, or is it giving a, or is it like, showing like a protective effect? So how do you do that? We want to do functional studies for that. I look forward to sharing my research work in the near future, and I would like to thank the donors for supporting this research. Thank you.